Hello, my name is Neil Smith. I'm a GP and one of a team of Cancer Research UK GPs that's here to help you. We know that primary care networks have been asked to be involved in earlier diagnosis of cancer, and we recognise that's a hard ask. So we'd like to support you all the way, and what's going to follow now is a series of top tips for myself and my colleagues.
Don't be afraid of the subject matter in the cancer early diagnosis PCN specification. Cancer is a very small but very important part of our work as GPs, and there is a lot of local expert knowledge to support you. CCG cancer leads, CRUK facilitators, lovely local public health teams. They will have the knowledge and be able to point you in the right direction.
Don't try too much at once. This is the first step in a multi-year programme. Link in with the QOF QI for cancer early diagnosis to avoid duplication of work.
Know where your local resources are and don't feel that you need to start everything from scratch.
It's really important to begin to understand and study your own data. Now, for some time we've had practice-based data, but very soon we'll get PCN-specific data. And if you can have a look at that, it can show you some interesting facts and figures. So, for example, you might decide to have a look at a tumour area that's common or late diagnosed in your area. Or you might look at some challenges with screening and decide to try to improve those. Why not utilise the National Cancer Diagnosis Audit? If you've done this in your practice, you'll get a practice report that you can use. If enough people have done it across the PCN, there'll be a PCN-specific report that will give you a real focus. But even if you haven't done it, there'll be some published information on interesting facts and figures and advice for GPs across the country that can be used at a PCN level.
Make sure you know what is happening in the local and wider system to avoid duplication, and build a community of practice. Link in with other PCNs in the locality to avoid working in silos and duplication. PCNs in a locality need to work collectively to avoid a wider community of practice. Think bigger than local, think system and think change. What we're ultimately trying to do together is support stage shift.
You will have enthusiastic secondary care colleagues who you can tap their expertise and ensure that you've got good lines of communication with primary care.
Consider involving the PCN practice participation group. Consider being creative with ARRS roles. For example, social prescribers could get involved with screening promotion, and if we're to reach out to the hard to reach, that could be a good channel to pursue.
So thank you for listening. And finally, I just want to reassure you that myself and my colleagues and CRUK are here to help you. We know that this is a challenge for you and it's an important task, and we want to be with you all the way. Thank you.